So loss ratio regulation. The loss ratio is for an insurance company, when I pay $1 in premium, how much of that dollar is actually going to healthcare, how much is going to shareholders, how much is going to executive compensation, how much is going to some program that has nothing to do with the healthcare for which I'm actually paying. As a department, we've been engaged with our colleagues from other states developing the definition of healthcare. Insurance companies, of course, want a very broad definition. They want to include things like anti-fraud efforts, payment of fees, payment of high-risk pool assessments, things like this in the definition of healthcare. We, as a state, have been leading the discussion so that it will be a very narrow definition of what constitutes healthcare. It will be what people would conventionally or traditionally think about healthcare, and then allow the state to make exceptions. So that if a company says we want to include our anti-fraud efforts as part of our healthcare costs in 2011, then they can come to the State Department of Insurance and we can evaluate that request and whether there's merit to it or not. But we expect that the federal, the national definition of what constitutes healthcare for purposes of loss ratio calculation will be very narrow, clearly defined and articulated. Don't underestimate the importance of the loss ratio regulation. It's not a panacea in any sense, but what it does is it assures that each of us, when we pay $1 in premium, we get value in exchange. There are companies in the state of Illinois right now that collect premium and spend less than 50 cents on healthcare. And in Illinois, of course, we're the Wild West for insurance companies, or the golden goose, whichever metaphor you want to use. And we don't have any authority or oversight, any ability to control that loss ratio.